Hello, good morning, everyone.
Good morning.
It gives me immense pleasure to present the 211th weekly webinar of AABN. This webinar series by AABN is indeed an eclectic one, bringing together small business owners, lenders, technical assistance providers, government officials, and members of the academic community to explore the challenges faced by today's entrepreneurs and to identify promising approaches to addressing their needs. Events such as this one is particularly valuable because they allow us to draw on a broad range of experiences and evidence. We are keenly interested in hearing your insights and look forward to sharing results from AABN's continued small business outreach. We have got an awesome speaker with fresh perspectives on the wellness web, interlinking human, animal, and planetary health to address us today. Let me extend a very warm welcome to our eminent guest speaker, Dr. Kalpana Kosalram, to this interactive networking session.
Thank you, sir.
It's a concept that focuses not only on human health, but wider on the health of our planet. Health is not only a privilege of human beings. Planetary health emphasizes the interconnected nature of human health and environmental health. This also makes a shift in the direction from human anthropocentricity to a more fair approach, health of the whole planet. Human well-being is dependent on the health of the planet, including clean air, water, and food sources. Paradigm shift towards planetary health promotes a holistic view of health that encompasses social, economic, and environmental factors. It considers the complex interactions between humans, animals, plants, and ecosystems. Planetary health insists on a preventive approach by addressing root causes such as pollution, climate change, and biodiversity loss. We should be aware of human responsibility linked to terrible symptoms of our planet like heat waves, fires, droughts, floods, etc. Planetary health approaches underline the importance of sustainable practices that protect the environment, promoting human health, but also actions to achieve that. By adopting sustainable lifestyles, industries, and policies, we can ensure the well-being of current and future generations. It is at a very opportune time that we have Dr. Kalpana Kosalram address us today. We are a few days away from celebrating the World Earth Day. The theme for World Earth Day this year is Our Power, Our Planet. So many ways to make a difference for our planet. I have the pleasant duty of introducing and welcoming Dr. Kalpana Kosalram. Dr. Kalpana Kosalram is a professor at the SRM School of Public Health, SRM Institute of Science, Chennai. Her academic focus encompasses psychology and behavioral sciences with a particular emphasis on public health research. Dr. Kalpana has contributed to various studies, including topics such as e-hospital management, social capital and health information dissemination, and the prevalence of non-communicable diseases in India. In addition to her academic pursuits, Dr. Kalpana is an active member of the Women Entrepreneurs Forum, where she engages in entrepreneurship. Her diverse roles highlights her commitment to advancing public health, education, and empowering women in professional spheres. With a diverse background, I'm sure today's gathering is special because of her participation. Dear friends, I hope you enjoy the program. Before we wind up, let me once again extend a very warm welcome to all and reiterate that our AABN's doors are always open to those who might want to strengthen our work with the suggestions. I also wish to place on record a deep commitment to work tirelessly as a team to carry forward the goals in a constructive, gratifying way. Take this opportunity to thank Mr. Suresh for his support with Dr. Kalpana. Thank you, and over to you, Dr. Kalpana. I request participants to remain muted, please.
Yeah, kindly mute participant, requesting the participant kindly mute your mics, please.
Okay. Thank you, sir, for that elaborate introduction. Thank you so much. Thank you, Suresh, for this opportunity. Now, at the beginning or at the outset, let me tell you, prevention is better than cure is what we are all talking about. But we all forget we are marching from a world of illness to wellness. So wellness is now slowly becoming a beaten glitch, and almost everybody in every aspect is talking about wellness, and wellness brings about physical wellness, mental wellness, spiritual wellness, so on and so forth. Now, suddenly, if you see, everybody is talking about spiritual wellness and mental wellness. So, what is stopping our mental strata to be very healthy? And still, it's a big question to be answered. So thanks to the COVID has brought so many terminologies on the web, wellness and planetary health, one health, so on and so forth. Now, what are we really looking at in this world? Really don't know. But world is certainly not what it was two decades ago. I still remember that. So I still remember that. All of you are versatile in Tamil, I suppose so. And மும்மாரி மழை பெய்தது செங்கோல் செழித்தது எல்லாம் சொல்லுவாங்க. இப்போ
Ma'am, sorry to interrupt you. There are few participants from outside Tamil Nadu, ma'am.
Okay, no problem, no problem. So there was a time where it rained 3 times in a year, and we had 3 harvests, which was very, very fertile, very people did not know what it was, the rich, the poor, everybody had food to eat, and there was nobody we saw a begging or something like that. So what happened here was, today we want to even rice, which is India's staple food. India is the capital of rice. So even that, I think we are in a stage that sometimes we are depleted of. So what is now planetary health we are talking about, right? We are looking at climate change. We are looking at geographical advancements. We are looking at so many, antimicrobial resistance in human beings. Today, we have a wide range of uh, every quarterly we have a new fever that is affecting us, undoubtedly. So today we have, I heard, yesterday when I was in the clinic and practice, I heard what was called the tomato fever. And that really shocked me because it was something that was causing itching, blisters, so many things. And they said the body turned red, and now it is on the move, and especially it affects adolescents and things like that. So, what are we looking at? We had H1N1, we had SARS, we had, that Zuko fever, and I don't know, every 3 months I'm very scared.
Bird flu is very common.
Ma'am, your system is muted.
And yeah, they say it comes from Kerala, it comes from all over the world, and people come, and I have never seen an airport about a decade ago with full of medical equipments, and right from the word go, you come out of the flight, you are asked to test your temperature, your blood, everything possible. Only thing they lack is a scanning machine, where they would scan you. If you give them, somebody donates every airport a PET scan, up to down, they will scan you and send you out. So these things grip us with a lot of fear. There were so many people who stopped traveling from India to elsewhere, or from elsewhere to India, because of all these checks. People were asked to stay in hotels for 15 days even before they could go home. And and with this came the advancement of planetary health. Though this E. coli, Klebsiella, and so many other microorganisms had already been there before time immemorial, we had suddenly heard of it spreading from individual to individual, and not only human, even the animals were affected. Now everybody says animal is the man's best friend. Especially dogs and cats are human beings' best friends. And now we never knew I think at least about 10 years or 15 years back, we never took our dog for a scan or for a surgery or anything. The dog lived with us 14 years. The dog was healthy. The dog was happy. We almost fed it milk and rice or mutton and rice. It ate it. Today, even for the dog, they take care of it like a human being. So these are all the challenges of the environment, and we are talking about animal wellness as much as we talk about human wellness. Now, why is this mental wellness so much being talked about? Uh, it surprises me. So I don't know whether you've heard of this word called cyber ostracism. See, now everybody is undergoing that. Whether you are an adolescent, you are a youngster, you are a young adult, you are a geriatric or middle aged or whatever it is, you everybody gets easily ostracized in cyber. What is cyber ostracism? These all are challenges to planetary health. That's why I'm talking about it. We all are addicted towards WhatsApp. All of us are in the social media 24 times 7, 365 days. And Instagram, Facebook, everything is in our fingertips. So what happens is, when you don't get that blue tick on a message immediately, when you don't get a reply, you just pause hardly for 15 minutes or something like that. When you don't get about 200 likes for your photo or for your post or whatever you may call it, you feel ostracized. You feel ostracized to the extent your mental health is really terribly affected. How terribly? In the sense, you are suicidal, you are, you are nervous, you're anxious, you're depressed, you're irky, and so on and so forth. Now, who are the gatekeepers that is going to prevent us from all these disasters just because you didn't get a blue tick or 200 likes? I'll tell you, I am also a victim of this. I post my photograph. I at least expect 150 people to like it in a matter of 3 to 4 days' time. When I don't get 150 likes minimum, Suresh Marisalam sir knows it, I get really, I snarl, I throw a fit. Why am I losing the market? Am I not wanted by people anymore? And so, in a cyber space, which is a virtual space where only you see people virtually, you feel ostracized. In a space of the world where you live socially, where you have interaction in human one to one, what happens? You ostracized, and something coming in between. 1 minute, sir. Ah, so what happens is we all get ostracized. We all. So coming to climate change, what is really climate change? We used to have come January. I mean, come October. Surely we had rain. There was no doubt about it. It rained till November. Then December we had the fog or whatever it is, the cold season. And of course, January, February, it started slowly becoming hot. Today, what is the situation of India, except for the hill station? We have only 3 seasons: hot, hotter, hotter. Sometimes it's only hotter and hotter. So, what does this bring to us? You have a sprout of chickenpox, you have a sprout of shingles, you have a sprout of typhoid, diarrhea, vomiting, gastroenteritis, so on and so forth. Why all these things? How does this climate change impact us? And how do you think planetary health is going to take us, a healthy planet, going to take us to a better tomorrow? This is what scientists, researchers, medicals, everybody is debating today. So when you talk about planetary health, what is it exactly? So yes, am I audible? Am I audible?
Yes, ma'am.
Yeah. Okay. So What happens is planetary health is nothing but a field of study and practice that focuses on understanding the interconnections. What are the interconnections? So the interconnections between human health and health of the nature. Why human health? Why health of nature? Means the systems on the life of the earth, it has to be recognized, it has to be given that due respect for us to have the well-being of the entire human population, and is intricately linked to the health of the planet. You call it ecosystem, you call it biodiversity, you call it climate change, you call it geographical change, you call it environmental health, anything for that matter. So planetary health emphasizes the need for a holistic, I mean, on the whole, an interdisciplinary approach to address the complex challenges posed by environmental degradation, climate change, and social inequities. What are the social inequities? It is not the good, bad, ugly. That's been the Ajit's movie. Is it between the rich, poor, and the BPL families? Not really. Social inequities, there is no justice. There is no, I mean, we are not looking at everybody and everything equally. There is a lot of inequities that makes us feel alarmed, right? When you go to a place, you have a separate queue in the airport for immigration check for people from a country. I don't want to mention the country. When you go to a shop, people from a different sector are given priority on the queue. And we people, I mean, I'm sorry to say this, have this very bad habit of jumping the queue. That includes me. In the airport, when you see one queue reducing, you want to run there. When you see one queue reducing, you want to run here. So what happens is we are all so disorganized. We lack stability. So we are not able to pick up on this environmental degradation or climate change or social inequalities or whatever it is. We are not able to accept. So what happens in this context? In this context is we are all looking at One Health. So what is it really? What is that One Health really talking about? In the sense, see, there are so many things we are talking about One Health, which is again a very new concept, and One Health is nothing but, if I have to tell you technically, it's a collaborative, multidisciplinary approach that recognizes the interconnectiveness of human, animal, and environmental health. Just think, why we can only talk about human health? Why are we talking about environmental health? Well, can you expect a world without fish in the lake or sea, without a goat or chicken or hen or whatever it is, without turkey on the land? Can you expect the world without human beings? Can you expect a world without, all the nature is supposed to be man's best friend. But what are we really looking at? Can you really exist in a world? Well, yes, world is 3 parts of the water, 1 part of the land, everything is there. But can you think of being in a world that has no environment, that's just insipid? You have a house, you live, you have a job, you work, you bring back money, whatever is available, the measly, measly vegetables, and so on and so forth. What happens here? Just eat it, settle for nothing, go to sleep, get up, next day again go to work. So this is not what it is. The entire fulcrum, the entire, what shall I say, the entire part of the world talks about not only human health, but also animal health, and not only animal health, but also environmental health. Only if we are going to have a clean environment, an environment with greenery, an environment with good water, an environment with good flowers, or an environment that has no pollution. Pollution is something we are talking about. You look at the carbon content, you look at the lead content, you look at the chromium content, all in the air. Can you go to a refinery without a mask today and come back unaffected? Have you before seen people wearing masks and running away? I mean, running here and there? No. Today we are all so, it's so strange that all of us are with masks. So you measure the air quality. It has so much of ingredients that would harm your lungs, that would harm your vision, that would harm your trachea, that would harm, your entire system. Why is this happening? And today they say the world's greatest wonders are turning brown, turning red or pink or whatever it is because of all the industrial drain. About it, we talk so much about solid waste management. We talk about so much of hospital waste management. All these things are being let out in the environment, and there is absolutely no cleanliness. There is absolutely no clean air to breathe. There are I was very surprised when I went to a beauty parlor, which is one of the prime beauty parlors in the city. You had to pay 300 rupees for 5 minutes of inhaling ozone. And it really made me feel funny because ozone is something that's available in the environment. And let me tell you a small story. The Tamil month between December 15th and January 15th is something the Hindu gods like Vishnu and all like very much. It's a cold month, everything is there. So what happens? Every woman comes outside the house, sprinkles water, sweets, and makes a rangoli. And that rangoli, they have a competition. Who does the biggest rangoli? Who does a colorful rangoli? Who does a floral rangoli? Who does a rangoli that is very picturesque? And why this was practiced before is people thought because God liked that month and to please the God and things like that, we did all these things, rangolis or whatever it is. But was it only for the women? Only women? Was it only for women? Even men. Men came out, did bhajans, went out to pray early morning, 4:30, the Brahma Muhurtam time, everything was there. What is this? There is a big scientific evidence which has been proved also experimentally behind this is during the month of mid-December to mid-Jan, the ozone layer is very much down. So what happens? People get to breathe this ozone easily. That is why they have been compelled to come out of their houses, men, women, or whatsoever, to inhale this ozone. But we all thought reasons were different. But this was one of the reasons which our elders or our olden people practiced, and this had so much of effect. Today, the whole ozone layer is like a poor man's banyan, full of holes. Where do we have ozone? So naturally, spending 300 rupees and having a few puffs of ozone in a beauty parlor. It's not a miracle. It is not something of a comedy. It is not something of a humor. When I looked at it, when I came back, when I referred, when I studied, I felt very bad to see what was happening to the environment and the impact on environmental health. No clean air to breathe, no clean water to drink. The atmosphere around you is also not clean. You don't know what is happening to you. Okay? So why does all these things happen? It is, I would say, rather than blaming the solid waste let out and industrial waste let out or whatever you may call it, it's been our carelessness. What have we done to keep our environment clean? what have we contributed? We have a very beautiful organization called Exenora. It was started by one Mr. Nirmal, and now we have very good people having franchisee or branches of Exenora. My own public health students used to go to this one Mrs. Mangalam, Dr. Mangalam Balasubramanian, and the water, the way they clean and that system and things like that used to be amazing. Amazing in the sense, the social awareness, environmental awareness, more than that, the concern for people she has is demonstrated. The experiment is proved in her work, and students used to feel a lot happy. The students used to feel a lot relaxed. Students used to feel so enlightened when they go for that, health visit and come back. They are all really happy and really thanks to her for that sincere effort. So we are all very happy in when you see people who are so environmental friendly. I am a person who is environment friendly. But what happens is climate change plays a very, very excruciating role. I was a victim of 2015 flood. It rained and rained like nobody's business for almost a month or so. And on December 1st, it rained cats and dogs. So I had to go to college university, and my university is about 35 kilometers from my house. So I had to go, and then there was no bus to come back, or there was a bus, and I was careless. I did not know. I had boarded a taxi. Taxi stopped Gudvancheri, 5 kilometers from my college. And the water level was rising. I had no other go. Then I had to get out from the taxi, pick a government transport bus, get down at Perungalattur, take another bus, come to Tambaram, where I was shocked to find out the whole transport system was paralyzed, and it was pitch dark. Somehow there was one good Samaritan who was coming up to Alandur to drop his company people who had to attend work that day. And I had paid 1,000 rupees to come from Tambaram to Alandur, which is hardly 15 kilometers. And from Alandur to, which is 5 kilometers, Ramapuram, I paid another 1,000 rupees for the auto. And he left me 80% of the way covered, and I had to walk. And that night, my house went 18 feet. 18 feet of water over my house. I lost everything. Almost I was stripped of everything. And next day, I had to run to my neighbor's house for protection. And next day, I found I did not have a change of clothes. But what happened to me was the most important thing when we talk about environmental health and environment change is our social capital should be strong. How strong? By the time even I realized I was in a disaster, I had people coming all over me the third day to help me. Money, clothes, everything poured, and I never even realized I was in such a big disaster. And I came out of it very nicely. We had Varada. Again, we were working that day, and with a paralyzed transport system. So what happens is such alarming, shocking environmental changes like cyclones, like flooding, like drought, all these things, earthquakes, which we have never heard of. We had the tsunami. Suresh Mariaselvam sir had really, heart and soul given given himself to work for tsunami people, and his work also has been highly commended. And come any flood or any disaster like cyclone or hurricane, he is the first person to be called because he is the environmental disaster representative of Tamil Nadu. So what happens is such shocking disasters bring to you upheaval of your mental senses. So it no doubt affects your mental health. You are depressed, you are anxious, there is a loss, you have to run away from that place, you have to flee, you lose your social senses, you lose people. Corona, how many of us lost our near and dear ones? Can they all be replaced? We lost people who even went with a good mind to take vaccination. Could they be replaced? And Corona came and swept us with a surprise. We did not even know. We thought we knew Corona and Corona 19, whatever it is. And hardly when I knew Corona, the next day all institutions shut down. We were all caught in a web. We did not know what we are going to do, and so many of I know the IT engineers did not have food. I remember all of us turned good Samaritan. See, impact of environmental health, impact of environmental social consensus. All of us turned good Samaritans. We fed so many people, we took care of so many people, whatever was available, we went, we bought, we all shopped as though there was no tomorrow, and we shopped till we dropped dead. Right? So, but why? With all that we shared, we learned sharing and caring and giving during Corona. So these are all impacts, social impacts that such environmental changes bring to us. So what happens is this One Health concept optimizes health outcomes. So when it optimizes health outcomes and addresses the challenges across these sectors by acknowledging what are all the risks, what are all the benefits. So what are for example, let us take cyclone, let us take Varada or whatever cyclone that is. So what happens is, the risks were, yes, there was so much of losses. Buildings were broken down, trees went down, shops were closed, and people did not have food to eat for a couple of days. All those things. But beyond that, what have we done to repair? What have we done to bring? What have we done to bring the environment to a consensus? So, have we worked on climate change? Have we worked on promoting a good ozone layer, which would be, which would be useful for all of us in this world? So, we are, I think, we are really, I don't think so. Each one of us are really contributing to the upcoming thing. So, unless we are going to work together, unless we are going to bring all our ideas together, unless we are going to generate a social consensus and economic freedom and things like that, are we going to really promote planetary health? Are we really going to promote One Health? Are we really going to delve into this web of wellness? So, wellness is something everybody talks about now. So, in this, it was not only allopathic medicine, all the other indigenous medicines came into action. We had Siddha, we had Ayurveda, we had naturopathy, we had yoga, we had homeopathy. All this, as if we had primary health centers giving us homeopathy medicine, Siddha, what was that water we were all drinking, and those tablets we were taking. All of us started believing in indigenous medicine, whether we had the impact of those medicines on us or no, we blindly believe. So this blind faith comes when there is an environmental impact, when there is when there is an effect, and naturally all of us work. So antimicrobial resistance, we wanted to promote immunity, antimicrobial resistance at any cost, because we all wanted to have a healthy life, and that is the day we thought what health really meant. Though we had online classes, we had Zoom meetings, we had the G Meet, we had so many innovations, be it IT, be it health, or be it economics, or be it governmental, non-governmental, NGOs, anything. We had a lot of innovation that's happening. I was very stubborn that I would never learn any of these IT programs. I would never take online class. But did I have a choice? No. I was supposed to learn Zoom. I was supposed to learn Gmeet, and I had to take classes because it was very necessary. So what happens is, when you're talking about One Health involves public health. today we need, because we are all relating not only to ourselves. It's not an allopathic issue where you go meet a doctor, we bought a Dolo, we bought azithrol, we bought XYZ medicine, we took the medicine, we took vitamin C and all the no. We are all relating as public health people or people who are all community oriented. We were relating to the community because the welfare of the community mattered a lot to us, because it was the community's immunity and well-being that mattered to the individual's well-being finally. Okay, so they called it the cattle immunity, and when it came and things like that. So today we are talking about One Health, we are talking about planetary health, we are talking about so many things. But aren't we taken by a rude shock with epidemics, with endemics, with pandemics, and all put together in a frequency of annually, half yearly, quarterly, or whatever we may call it. So what happens is it involves public health most important, where we relate to the community and we think of community's well-being. It stretches to the tribes, it stretches to the BPL families, the rural, the most rural, the city, the urban, the semi-urban, or whatever we call it. So what happens is it we are talking about veterinary public health here. And along with veterinary public health, to promote good veterinary public health, we need to talk about environmental sectors too. Because unless otherwise we have an healthy environment which is free from drought, which is free from disasters. Now, the National Institute of Disaster Management has taken disaster management very seriously, and they're going all out to promote good solutions for disaster management. So I see suddenly so many people doing research, even in my own university, on disaster management. So there are a lot of social networks happening. There's so many, people are trying to gather messages, and even how message, neural networking and things like that, how messages spread, how messages are collected, how an environmental impact for a disaster is determined, and things like that. So what happens is One Health is particularly related to food, water, safety, nutrition, and control. Most important is control of zoonosis. What is zoonosis? Any disease that is caused by animals, that can be spread by animals, humans. And an example would be flu, rabies, and Rift Valley fever. All those things come under zoonosis. So what happens is we are talking about pollution management. We are talking about combating the antimicrobial resistance, the AMR. Unless otherwise we are able to combat the AMR, the antimicrobial resistance, of course, there is no two ways about it. It only happens with the antibiotic therapy. So what happens is, who makes this One Health approach work? Well, government officials, researchers, workers across sectors at the local, national, regional, global level, they all should give you a hand. And unless we all put our hands together, we will not be able to elicit any threat. Okay. Any threats, I mean social threats, health threats, or environmental threats. So what happens is, how do you do it? The major fulcrum in doing this is you need to share database and surveillances across different sectors. So only this will help you identify new solutions, so that we will be able to address what is most needed is to eliminate the root cause of the problem. Okay. So how do you eliminate the root causes? You need to link between what is called the risk and what is called the impact. So in this, what is really needed? What is really needed is what you call as community engagement. Any community disengagement makes your program or makes your commitment or makes the approach a disaster. So what happens is it is also critical at the same time to promote risk reducing habits and attitudes and to support early detection of containment of disease threats. How many of us stayed at home? We stayed away when it was COVID-19. We all stayed away. I mean, everybody, all of us were mentally sick because all of us had what is called the paranoia, the disease of suspicion. Will this person have? Will this person be a passive sufferer? Will this person be an asymptomatic sufferer? We wouldn't know. We would pass on to the family. We would be excluded from the community. There would be a board before our house saying this family is suffering. How many of, but they were at the same time good souls, especially when you go to a gated community living. People knew house A1 or A2 had two people with corona. They will never even knock the door. They'll come, bring a tiffin box of food all the three times, breakfast, lunch, dinner, bring some clothes or whatever you needed, leave it at the doorstep, just ring the bell and go away. At the stroke of the bell ring, people know it is food for them and they used to take it out. So we had both a good impact as well as a negative impact. So this positive and negative, did it merge? No. The paranoid continue to be paranoid. The people who are very overwhelmingly social conscious or had the social consciousness continue to be somewhat managed. The deaths we face, people refuse to even remove the body, especially if they knew the person died of COVID. What happened is ambulance were at such, it was such a disaster when there were no ambulance, there was no oxygen supply. People had to borrow here and there, either, right from chief, the government authorities to the ministerial level, everybody was working to get, and lack of oxygen also, we had so many deaths, which was inevitable. So you couldn't take a COVID person home. So people who are, I know my own uncle who was 97 could not be brought home. He died in a government hospital. They refused to give the body. People who are very big directors or whatever you could call yourself, anything to the menial, were not sent home even for their last rites. They were just taken straight away to the graveyard and done their last rites and things like that. His wife, who was 94, was secretly taken with lot of masks and the PPs and whatever they call it, quietly to see the husband whom she lived with 67 years for one last time, see his face and come away. It is all very ironic for us to hear, and it was very painful. We all cried. But did we all have the, did we all make an effort to go and do something about it? Did we have the onus of responsibility? Absolutely no. So now, what is WHO or various health agencies, your ICMR, etc., doing about One Health to promote environmental wellness, well-being, health, or the wellness concept of social wellness, spiritual wellness, mental wellness, physical wellness, and all this? WHO has formed a One Health initiative to integrate work on human, animal, and environment health across the organization. The WHO is also working on Food and Agriculture Organization, United Nations, the Environment Program, the UNEP, and World Animal Protection as One Health quadripartite. The One Health quadripartite, if it is going to come in full zoom, that will help the whole community come together to save the environment, to save the individual, to save the society, to save the social well-being of the, shall I say planet or shall I say globe? Anything, whichever you need, I leave that answer to you all. So what happens is the quadripartite is promoting multi-sectoral approaches to reduce human health threats, both to human, animal, and the ecosystem per se interface. So what happens is the transformations that are required to prevent and mitigate the impact of current, future of health challenges at global, regional, and country level is clearly underlined in the quadripartite One Health Joint Plan of Action. Okay, so we are looking at all these things. So how they're going to investigate, how they're going to promote human activity, how they're going to preserve wildlife, how are they going to preserve the environment, how are they going to preserve the water resources? Because any disaster, the first thing to be affected will be the water resources. And that is the danger for all existing human beings. So, and water resources, many places are depleting. We have the melting glaciers, we have the, sometimes hill stations are having a lot of heat and um, ordinary places are having a lot of chill. Because I know Chennai had a lot of fog and chill climate until about early March, which was never which was never happening until now. So, what are the critical areas One Health is looking at is food production, distribution, urbanization, and infrastructure development, international travel and trade, and that all leads to biodiversity and climate change, and that puts the increased pressure on the natural resource base. So, emergence of zoonotic disease, and how are we going to prevent? If each one of us are going to put $1 on the table, I think monetarily, but if all of us are going to put that dollar on the table, whether it is your intellectual property, whether it is your well-being, your goodness, or whatever it is, we're going to join hands. I think we, not only India, not only the globe, not only the whole planet is going to be a very safe place and a happy place for all of us to live, because that is what we are all looking for. Morning you get up, you don't want to see any disaster. When you come back home, you want a happy, cozy home. You want enough water, you want to have enough food on the plate, you want to have healthy, clean food, and so on and so forth. I can keep talking so many things. You don't want illness. Today, with the populace India is having, India has been proved more than twice. It is the diabetic capital of the world. Why? India is the diabetic capital of the world. India is the lipidemic capital of the world. India is the hypertensive capital of the world. So more than anything, why? Because we all carry it genetically. That's only one part of it. But the stress we put in our day-to-day living, the anxieties we develop, we are all not able to foresee a healthy future. So, are we all really looking at? So, we have talked about One Health. We have talked about planetary health. We have talked about wellness. We have talked about prevention is better than cure, public health, so on and so forth. What are we really doing for geriatric population? All right? India is going to increase its geriatric population by 2029, 30% more, because the age of death has been increased from 75 to 85. Now, every individual lives until 85. So, what are we going to do? What are the initiatives we are taking? Yes, the rich can move into assisted living, and the sprouting of assisted living. Like you have fertility centers sprouting everywhere, we are having sprouting assisted living. So everybody wants to go abroad. Everybody wants to leave their hometown. They want to leave their own country. They're going. So sending that dollars, which amounts to even, and it's a huge amount, and to spend for assisted living for their parents, or only one parent is existing, or whatever it is. So what is the answer for these insecurities these people develop? Is it going to give our planet a healthy living? Isn't it a challenge? Isn't it risk we are putting on our life, putting them in an unknown place? See, I had met one of the geriatric lady in assisted living, and she's an erudite person. She was about 75, and her husband had passed away, and her son did not want. She was very well qualified lady. She was working until she was 60 or 62. Then came the phase not to live alone for a lady. She moved into an assisted living. I asked her, what? You have everything here. You have a room for yourself. You have food, very good food, healthy diet. You have a nurse to call on you. You have a doctor to call on you. You have everything in this world. But what makes you annoyed? What makes you frustrated? What makes you depressed? And why are you not so happy? You can be yourself. You can do so many things to the others, help the others who are, invalid or whatever you may call it. She said, I was living in a 4-room house, about 2,000 square feet. I had a hall, I had a dining hall, I had bedrooms, I had a guest room, I had everything, name it. I had cupboards and I had crockery sets and I had a gas stove for my own, microwave and whatever you may call it. But today, everything is compressed to one bureau here, and I compressed everything when I left my house to 2 suitcases. She had rented the house, or I don't know, she sold the property, and it is a prime area. She said, I was living in a prime area. If I turned this side, I had Reliance, and if I turned that side, I had Great Stores, and I had all the hotels or whatever it is. And I'm in a remote area now. I may have everything. I can have a good walking center. I have a good gym. I have a good bed. I don't need to cook. I don't need to look for morrow for anybody. I don't need to look for guests. How to cook, what to cook, nothing. I am happy, no doubt. But when I suddenly see my whole existence and being in a one cupboard, one bureau, or whatever you may call it, from a 2,000 square feet house, that hits me hard when I sit back and think, and I'm not able to close my eyes in the night. So all these things are traumatic. When I heard it, I couldn't sleep for that night because it was traumatic. What if it happened to me? I have nobody to look after when I'm 65, 70, and I need to move. What happens to me? So what are we doing? If we are going to promote good climate change, good environmental health, good things, I don't think so. And a healthy individual, mentally, physically, spiritually, I don't think all of us will feel safe in the cozy nest of our house, and we can continue the same living. So let us promote good environmental health. Let us support the One Health. Let us support our environment, meet the challenges. I think we will be able to see a very healthy future or a healthy tomorrow as long as we live. Thanks for this opportunity, Suresh sir, Gopi sir, and who all have been in this. Thank you. Any questions? The forum is open for questions.
So, before going further, I would like to request Mangalam ma'am to add some points to that. Mangalam ma'am.
Oh, that's lovely. I'd like to hear from the horse's mouth. Ma'am, please.
Mangalam there.
Recording in progress.
Hello, Mangalam ma'am. So she was there.
Sir, so she's not there, sir. She's not there, sir.
Okay, anyway, I would like to request now we have Shubha Jairam with us, and she is a former UNICEF consultant. Earlier, she worked with Christian children from Canada, and now she's doing her PhD under Dr. Kalpana. And she can give a little bit about children's health and the environmental health.
Hello.
Hi.
Hi, Shubha.
Hi, ma'am. Hi, ma'am. Thank you, sir. Thank you for adding me. Very good to be part of this. And it's very comprehensively, Kalpana ma'am has, put forth that climate change. How are we actually, heading, or what is the perspective of climate change, and how is going to really affect our entire globe and humanity. As Sureshwar actually wanted me to, highlight on the issues for children. Definitely, this is an alarming thing, as we are entering into a world where, as ma'am rightly pointed out, there is a children are not adolescent children are not eating properly. The food patterns and diet diversity is going to be an issue, and there is a lot of health and lifestyle patterns is changing, and the social media is really alarming. And so this kind of environment will put children will be more vulnerable in terms of having more low birth babies, or like children with disabilities could be more. And the pregnant mothers, the maternal childhood is going to be really alarming. So this is there are cases and evidences is being generated as like when the vulnerability is more due to climate change and sort of heating, like heat waves is going to be very high. And extreme weather events is going to affect the women and children more, and so on and so forth. I don't want to brief more. And definitely children and women are more vulnerable in terms of the upcoming years.
You're okay, Shubha?
Yeah. Yes, ma'am. I'm fine, ma'am. Maybe I would leave the floor for questions, ma'am.
Now, one more thing I want to add, the environmental health, what Dr. Kalpana was talking about. We are now facing a problem with refugees now. Migrated workers and refugees is the biggest challenge we are facing now. Now, after globalization, liberalization, privatization, and globalization, a lot of migration is happening worldwide, and in India also, you might have noticed, especially in the context of what Dr. Kalpana was talking about, you might have witnessed the long walk by our the informal sector workers from Tamil Nadu to all the way to North India. So this environmental health is facing, causing a major problem among the refugees and internally displaced people. We call it as IDPs. So IDPs and refugees. Now refugees, the problem is one country to another country. Now earlier because of wars or because of jobs and livelihood was there. Now it is environmental refugees are happening because of the environment. Now see from Shirapunji, which is very famous for round the clock rain. Rain. So people, there is no rain now, and people think since it is raining, agriculture is the major livelihood. But actually, looking at the tourism is a major industry over there, because people from all over the world visit there, but because of the rain. Now there is no rains or poor health conditions. The people are migrating, especially in and around the Sundarbans. Now, if you look at three scenes, and I think last time also I talked about it. Again, I want to point out, if you look at it in three different angles, because I learned it from my mentor, Dr. Deepankar Dasgupta, who was doing his research studies in and around Sundarban. He was my mentor. When I went visited him in 2012 or 13, the newspaper on that day there were 13 or 14 women committed suicide on one particular week. So I was so surprised how it happened in the same place, and 13, 14 women committed suicide. Now, if you look at the scenario and from the point how he explained, now from Chirapunji, young couple who got married, or maybe love marriage, those who against their family got married, they have come all the way to Calcutta. That's one scene. In Calcutta, earlier it was, now it is Kolkata, earlier it was, infrastructure development is happening, country still happening. And earlier people used to sleep on the platforms after the work is completed. But after some time, they said because of so many accidents are happening and expansions, they said the workers cannot stay at the platform. They have to go outside the city and come back for work the next day. So the women could not travel. So they had an agreement that most of the people prefer to go to Sundarbans area. That's the biggest backwater area where mangroves are there and water bodies are there. So women would go for fishing, men would go for work. That was the understanding. And it was okay. So far, so good. But this is one scene. And third scene is now after globalization, a lot of industries, especially Calcutta, is known for big industries. And in and around Calcutta, there are a lot of major industries that are happening. And the grey water and the wastewater, which was coming, the chemical mixed water was coming and getting mixed up with the Sundarbans water. And because of that, the water was contaminated. The women who are working under, in the water, fishing. So their waste level water, they have to go and fishing, and their reproductive organs were all infected. So they could not get involved in the family life. So the men started finding partners outside the marriage, and that gives some kind of a insecurity to the women, and they are all from different places. They don't know anybody to advocate for them. And finally, they decided the only thing is commit suicide. So you see how it is affecting from one point to another point, and combining all this environmental health and industrial issues, and water bodies getting contaminated, and the human life and social life, and finally it is causing human life. That's what we have been talking about. So that is what the highlight I understand from Dr. Kalpana, because she tried to combine. In fact, she had the animal health also. How we were taking care of the animals. Now we have to go and check up the animals and things like that. That's added thing. So now we are in a crucial stage where we have to seriously look into our personal health, physical health, mental health, environmental and occupational health, and animal health. All these combined together, because health is the only thing which you cannot buy or sell or anything. Ultimately, the whole life is based on the health. Even if you have everything, the health is lost, everything is lost. So ultimately, this topic, or Dr. Kalpana covered, was a very valuable subject, and I would like to invite our members for a interaction session. Thank you.
Yes, participants, you may please unmute and ask your questions, please.
Yes, sir.
Good morning, Kalpana madam. My
Good
name
morning,
is
sir.
Vikram.
Yeah.
Actually, I totally agree with two participants, which they highlighted the problems the people face in the society.
Yeah.
The core of this is, I feel like, is mainly digitalization of the society. That is causing all sorts of health issues to all the women and children, and all to the complete society. The biodiversity is getting affected. So even the government is trying to make the villages digitalized. So is the way forward digitalization good motive, or it's a bane? So digitalization in villages is a very worst worst motive, I would feel like. Is it correct, the way forward?
Sir, thank you for that question. It is a good question. Digitalization is certainly a good way forward. The thing is, it's a necessary evil, no doubt about it. See, it all depends on how we take it or how we use it. See, if you're going to be hanging on a social media or a virtual media or a visual media 24 times, 7, 365 days a year, it is certainly not a good move. But if you know how to curb it, ration it, and say use it for educational purposes, financial purposes, and get over the flaws or get over the evil from it, like your account gets swept away and all those things, come out of all these things. And if you look at it, digitalization is good. The aftermath is, yes, chatbot people use a lot, and now journals where you publish is not only looking for plagiarism, but they are also looking for the impact of AI and the usage of chatbot on it. As a way forward, digitalization is pakka. It is a feather in each one's cap. But nonetheless, how we ration it, how we use it, and how we make the best use of it matters a lot, sir.
Okay.
Yes, sir.
Thanks.
Thank you, sir.
Yes, ma'am. Niyata, ma'am. Dr. Shamla?
Before the next question, may I add a few points to Vikram's question?
Yes, ma'am. Please go on, ma'am.
So Mr. Vikram, as Kalpana ma'am said, like the digital innovation is very much needed. Okay, there is no doubt about it, because it also helps in mitigating a lot of problems. But the other perspective of digitalization is like nowadays most of us wants, or like the youth want mobile phones, smart watches, everything wants more of single use materials they are actually using. No, is there is any proper waste, I mean the digital waste management system is available? It's not there, because they are just throwing it, and there is no proper usage of the waste management. So this is going to cause more problems, because it is just the single use, whatever the single use plastics. I read in a report, almost India has produced single use about like 40 million single use plastics in a year. And they just the recycling is not happening, like maybe 9 to 10%. This is the official report which has been the percentage, like 9 to 10% only gets recycled. So the rest of 80 to 90% are there, like left unattended. So this is the main cause of environmental degradation. And also, like, there are research evidences being proved that microplastics is prevalent. It is there in our food particles. It is get the single use plastics, it gets into microplastics, and it's there in the water, it's there in the food items, and etc. So this is also a bigger problem. It is like not only digitalization is very good. How we are here, like 30 people are there, like how many of you have unused mobile phones in your homes, unused chargers, unused laptops, like we are not disposing it properly, or we just throw it out. This is just a simple thing. You can magnify the issue also.
Okay, I agree with you, Subha madam. Actually, it is incineration or the burning of all sorts of digital devices, plastics, solution to a green future?
We have to do it properly. We have to decompose. We have to if it is a menstrual thing, we have to incinerate, and we have to have the proper recycling plants. Recycling things should be there. Otherwise, like, everything is a burden to the earth actually.
Actually, there are crores
We have to
of
reduce the consumption. Are we interested in reducing the consumption? We have to reduce the consumption. How much load that we can give it to the mother earth? It's very difficult. It's very alarming.
This earth belongs to God.
No, actually, to precise to that, now the research
Yes, ma'am.
researcher.
I would also like to make a few comments.
Please, ma'am. Please, ma'am. Yeah.
Yeah. See, I'm glad Ms. Sudha brought up the whole issue of electronic waste management. And definitely no incineration is not a solution. Please don't go that path. It's dangerous. In fact, just before this webinar also, I was, listening to a podcast on lead pollution that is happening in Bangladesh because of the recycling of automotive lead batteries. So you're absolutely right. In India, this is the perhaps the right time. We really need to get into proper research on, this whole category of not just electronic waste recycling, but as has been pointed out, the presence of heavy metals I don't know how many people are aware of this whole issue and where all heavy metals is being used. Generally, on the periodic table, almost everybody knows that these are highly described and they have very high atomic number and atomic weight. Not only because of that, but the fact that these are generally present in the core of very, very deep inside the earth. And so all these are mined out, and then they are used for, in various applications, right from pigments and paints, even in, certain kinds of colors used in plastics. It is also used in electronics. I think many of us must have listened to some time or the other this entire debate that is going on rare earths and various types of rare metals which are used in the making of electronic products. And today, there is a big talk about how India, at least if not in the very small, below 100 nanometers, semiconductor chips, but it may go in for manufacturing for the slightly bigger semiconductor material or chips. This is being looked at. And are we really prepared for it? It's not only the fact that whether we can get rare earths from China, or now that Ukraine it is not possible, or are we going to go do through electronic recycling? Do we even know anything about it? Absolutely, because we have been trying to look at what are the dangers and hassles and what are the kind of hazards that other countries are going through when they are doing electronic waste recycling, not just what comes out in YouTube's, about Cote d'Ivoire or in China, Guangzhou or someplace, but actually, what is it that it involves? Even what is happening in a very sophisticated facility like Unicam in Brussels or Belgium, or in Tessam or various other places, or even in Japan. So this is the real time, to do research. And I think many of the states which are capable of manufacturing, and especially many southern states which have taken up a whole lot of manufacturing, or I don't know whether it's manufacturing or assembly, whatever it is, in of especially automobiles and various other kinds of assemblies and manufacture of even, the Foxconn by like mobiles or Samsung or any other things that are going on. Because if we don't put, proper pollution control measures in place in a manufacturing unit or in a recycling unit, or even understand what are the kind of hazards, then we will also end up like countries like, which is our neighboring countries, where, the lead automotive battery issue is very, very prevalent here in northern India. And Rajasthan is just full of it. We watch YouTubes for Bangladesh, but we don't watch about what is happening. So many NGOs have tried to bring this, and there are so many run by night operations where, even despite the fact that we have the batteries regulations rules, there is a one company, which uses its name to purchase all these used automotive batteries from different countries, and then they just pass it on to very small operations which are there in very, very remote areas, including in places in desert areas in Rajasthan. And there is complete lead in the air. So this is just one example. So when we did, my student and I did the analysis of groundwater near a huge, what do you call it, landfill mountains or dump sites in Delhi. We found even heavy metals like cadmium, chromium, lead, of course, even mercury, and several other heavy metals in the groundwater up to 5 kilometer radius, and it was spreading. And that is because we are throwing, that means that even in domestic hazardous waste, we are using so many of these highly harmful substances, and which are just being thrown. And because it is all unlined pits, the rainwater is just leaching it and taking it. And, many of these landfills are also, to begin with, alkaline, then acidic. So they release different types of metals during different seasons. And it's there in our water, in our air. So when you have battery recycling and you're burning, and, incineration is nothing but creating a landfill in air. That's all. Instead of having a landfill on the ground, you're having a landfill in the air. So you decide what you want to do. So, and matter can be neither created nor destroyed. So if you think the incineration will make things go away where? Where is away? And so if you're not going to be able to capture it in proper, and you don't know exact quantity, and you don't know how to capture it in bag filters or in various other electronic filtered it's filtered devices, and you are able to quantify exactly how much is it that in the ash that you've been able to get these kind of substances, and do you know even how to enclose it or encapsulate it or even make it. There have been any instances, several instances in the world where they have tried to encapsulate and try to bury it in the ground, and then it appears, it comes back. So I think we really need to do proper research. And if India, especially certain states, especially the southern states, if they are planning to go into bigger manufacturing and forget about space technology and all that, just making a little bit of chips for your own use, if we are going to do it, we better start doing proper research, because these kind of substances have extremely ill effects. From the Center for Chronic Disease Control, we are trying to study, and the effect of lead on children is devastating. Even on adults, it's devastating. And lead is such a well-known heavy metal. There are any number of other heavy metals about which we don't even know. So I think we should really go into proper scientific research on this, and spend some of our time and money on this. Thank you.
Well said, ma'am. This is really very good. I think I'll just add a point which Kalpana will complement. See, there are four components. Since we work for the UN officers, we always look into the coordinated efforts of various stakeholders. For example, Madam rightly said, the academia has to take the lead, identify the problems, and come out with a solution with the evidence of indicators in the light of literature review. And the government, next one is the government has to take it very seriously. And if any amendment has to be passed or any policy has to be changed, that has to be introduced, including some kind of punishments which are for the violations, or maybe some kind of encouraging policy matters like, returning the bottle and you'll get some money or something like that, where encouraging the community to come forward and reduce the waste level. And third one is the NGOs. The NGOs they are bridging the system, the community. So they know each and every person's individual attitude. So they can translate or convert the idea of the government into a community level, and they can bring the change. And finally, the industry. The industry has to support, because they are also part of this environmental health concept. So they have to support the academia or the NGOs with through their CSR funding, or maybe any other funding that's available, so that the academia, government, NGO, and industries combine together, and then they should have a resource center where all the information should be stored, and the best practices or the good practices have to be documented, and making a pilot study on various things. For example, we're talking about incineration. Now, earlier, it was Pallikaran, it was happening. People are burning it. And students from Stella Maris did a study and said there is a lot of signs of cancer has been found. So after that, we advocated, and now government has issued order to all the mobile companies and their service centers that there should be a basket has to be kept where the used mobile phones and laptops or any from any company could be, because people did not know where to dump it. They just used to burn it and get that lid there and the coil inside. Now it has been advised to go and deposit at the service centers. So something like that, one after other, we can experiment. And at one point of time, definitely we can make this as a culture that community should be sensitized that it is for your health and for your generations to come to take care of the waste management as well as the environmental other issues what we talked about. So these four pillars, that's how we always talk about. Agni, we call it as A for academia, G for government, N for NGOs, and I for industries. All the four have got a role to play, and when they join together and have coordinated effort, will definitely make that way. AABN has got a lot of engineers who are all working in industries and having your own business and academia. So you can come forward with some ideas. Maybe Dr. Kalpana can take a lead on research organization, research efforts with the government support. And we also with Subha also we can find out the sources which industries are interested. We can definitely make AABN as a good platform for take this forward.
Gentlemen, my name is Muthukumar. Is it okay if I add some comments?
Please go on, sir. Go on, sir.
Yeah, I am known to be controversial, madam. So the fundamental issue, ma'am, right? I'm a researcher myself. The only important thing is, see, one of the biggest problem in this topic is that we only talk about low-hanging fruits. The fundamental issue, if you look at honestly looking at whatever we discussed here, it is there everywhere. Everybody's talking about it. Everybody is saying that it must be done. It should be done. We should do this. We should do this. Let us do this. But there's no solution for it. What we end up is low-hanging fruits, actually. We always do that, whether it is from solar to this, the low-hanging fruits. We always go into the communities and do that. First of all, the most critically, madam, we are all intellectuals here in this forum. Everybody's highly qualified, studied, and everything out. Fundamentally, if you look at the last 2,500 years, before the science came into picture around the 16th century, it was more of a societal and a philosophical construction. The entire society worldwide was most of social construction and philosophical construction. Almost for 1,500 years, nothing happened there. Then around the 16th century, because of people, all of you know, like Newton and all these people, suddenly you have moved into science, technological construction. Fundamental scientism did not improve, but technology, the whole world became a technological construction model. And that happened actually in the 20th century, the whole of its technological construction. We have to agree to that. So what happened to that time, where the manufacturing plants and everything started, the people, the peasants and farmers were kind of lied false propaganda. They left their fields, came to the factories to work and got stuck to like poor conditions. We all know the story. And then the third one happened with the financial construction after the globalization in 1990s. We all moved into financial institution. The whole world was run by finance. You remember that if you are honest and you think of 1990s, in most of the technological institutions, organizations, manufacturing, only technical people were ruling the world. Technological people. After 1990s, if you look at everywhere in the world, the CEOs are only finance people. They do not have any idea about technology. They don't have any idea about whatever we are talking actually. This is a problem. Whatever we are talking about is only people of technological mindset, not the financial mindset. These people have taken up financial institution. And now after 2017, we have gone into the artificiality, not artificial, the artificiality as defined by Elul, artificiality construction. Today we are in artificiality construction where the inorganic materials are moving into organic materials. You see that actually. We are putting inorganic material inside our body in so many aspects of it. So even from our mind, if we talked about the digitalization, with digitalization nothing but inorganic entering into organic biological mindset. We are controlled by digital. We are controlled by everything. It tells us what to do, what to think, who to get married, how to live, how to do this. Everything is done by digitalization. Today, whether we like it or not, the digital models have taken up complete control of every one of us, including us, people sitting here. We talk about so much about waste management, but none of us will throw our mobile away. None of us will throw our laptop away. As you already asked, how many people have it? Yeah, I have 4 laptops in my house and 3 mobiles just in front of me. But we don't throw it out because we talk a lot, but we don't step ourselves to do that. And how many times we buy plastic water bottles when you're traveling in a bus or car? We do that ourselves. So it is again that decision is taken up. So what is important is the only way, madam, there's a lot of whatever we talk about, right? The biggest challenge is happening today in the world. If you look at the biggest challenge for the future is the global disparity model. What is going to happen? There's going to be a soup. This is what is going to happen. Irrespective of what we talk about, let the government do it, NGOs do it, these guys do it, whatever we do about it's all for the low hanging fruits or the low level of financial, educational, economical people. But what is happening without we realizing it, there's a big, major, the world's first, the challenging, the biggest disparity is happening. There's a global super rich is going up one level, and the global super poor people are coming on the other side. There's a big gap is already developing right now, and that's not going to be closed out. That is not going to be closed out. Whatever we talk and do actually is going to end up in trouble because when you get about 9 to 9.5 billion people in next 20 years time, we have no energy, water. Nobody has got a plan for it, and we can't tell that let's. So somebody, a professor like you, madam, the reason I'm talking to you is you are the one who can talk to the youngsters to understand. We have to come out of all this traditional, conventional model of let's do it. We have to look at from a paradigm shift of revolutionary models for the youngsters to learn that how to break it. The only way to do it is to educate everybody individually to ensure whichever happening. But we have to, let's not worry about what others do. We, as every individual, has to take a decision. I will educate 5 people or 10 people, 15 people, whatever we can do it. As you said, intellectually, but financially, whatever way you can do it. And that is the only way option because nothing is going to change in this world because today is all controlled by commerce, irrespective of whatever we talk about artificial intelligence, ethical standards, moral standards, whatever we talk about, nothing is going to stop. Nothing, everybody is going to go for the AI supremacy to win the race, irrespective of what is happening with the humanity. Nobody's going to be bothered because something goes wrong. People are going to be, madam, only one question. You are not a lot of knowledge as a professor. 2 questions I'm asking you to think. Why they're spending more than $3 billion to $5 billion a year for cancer research, but less than 150 million for tuberculosis research? Answer is tuberculosis is a poor man disease. Cancer is a rich man disease. Some medicines are one cancer medicines, one tablet is 1 crore to 3 crores. Tuberculosis is freely given by the government. That is one of the reasons. You can see it very clearly. And same thing, we can talk about so many aspects of it actually, madam. So my sincere advice, sincere suggestion, sincere proposal for someone of your caliber, professor and knowledge and everything out, when you have so much opportunity to students, please, madam, you can think about the ways of revolutionary under making them understanding instead of conventional model because whatever we talk, small improvements we can make, but that is not going to help. We have to go for paradigmic shifting events, which will uplift everything in a single goal. And that is what we have to prepare the next generation. Our generation is already gone. They cannot be taught anything. We're wasting our time talking to 45, 50, 60 years old people. Like we have to do this at the 20-year level, and you can do it now. Thank you.
Thank you, Dr. Kumar. Well said. But that is why again I'm insisting on the coordinated effort of academia and industry. For example, last year, Shubha is here, she will compliment. We both met 3,000 students in 60 colleges. We talked to them and they are so happy. And someone is talking to us and discussing about the climate change impact. And they came out with a lot of ideas. We didn't want to insist anything from our side. We explained the situation and they worked out. And we had seminars Tamil Nadu, all over Tamil Nadu. And then we decided to come out with a manual. And the idea is to select 1,000 students from Tamil Nadu, from across all the state, all the districts, train them. In turn, they will go and train with case studies and everything. But unfortunately, the manual is ready, everything is ready, but still it is not released. There is some kind of a red tapeism is happening. Till it is almost 1 year, it is lying as it is. So now what to do with that? So we are also helpless. We cannot release it as it is. What do you say, Shubha?
No, sir, I would like to come in here since I worked there. So, sir, as Suresh mentioned, so it's like empowering the youth is very, very mandatory. There is no doubt about it. Okay. So it's like, we have to inculcate the youth's knowledge on climate change issues and they have to become an agent. That is number one. So we did a pilot, like as Suresh was saying, like, we were able to reach out to 15 in Tamil Nadu. We went to 15 to 20 districts and we did it's a 1-day program. We documented the youth's perception and also we documented what is the current level of youth awareness level. And also when we were giving this content to them, the youth were able to, receive it properly. And the moment we gave that, the content, immediately the youth were willing to change. We could see that. So what I am proposing here is like, you are all experts in various fields. There are models, like, so we have to scale it up into different areas. How are we going to collaborate that? So we can actually think and to, do such models, and that models can be, done in Tamil Nadu, done in Andhra Pradesh, or done in Assam or wherever. So there are models, evidence-based models are available. We can actually create a platform. As Suresh was mentioning, we were actually planning to, take 1,000 youth and become a youth ambassador for climate change. This was our idea, but due to various reasons that didn't happen. So maybe it can happen now also. Like, the content is available, the strategies is available. Like, we can actually develop that one and we can inculcate that activity and we can develop the 1,000 youth who can take it to the communities as well. This was the thought which was last year there. Still, it holds good. So we worked
thank you.
thematic areas, like, for example, like, heat waves, how heat waves is, affecting child and youth and the generation. And the second is like, the extreme.
No, the idea is, you rightly said, Dr. Muthukumar, there's no point in talking about this 50 years, 60 years.
Sir?
Sir, Suresh, sir, we lost you.
So as you rightly said, Muthukumar sir, like, we have to we have to educate children, we have to educate youth, and we have to do research, like as Kalpana ma'am's expertise, we have to do a lot of research. So we need collaboration so that we can actually take it forward. It's like, academics are there, research we have to do, we have to strategize it properly, and we have to take it forward to the next youth. So it's like we can do, like, we will do handful. We don't need to do this much. We will do handful so that we can develop good models that will be sustainable models. We can do it. So that's what ma'am, over to ma'am.
Yeah, I have a suggestion. I feel that, since we have such very good academic institutions, of course, in in the south and a few here also, where I live in New Delhi. Why don't we, through the ZNBN, why don't we, especially have some discussions or forums on potential PhD topics, because very often I get called, for either reviews or for, guidance. And I find that many of the PhD topics are repetitive, and people haven't really put any thought into it. Maybe the mentors, they look at it more from the funding point of view, or because it is the industry which can really come forward, and we can try to set up say good a certain what do you say, a quantum of funds which can be available for innovative research projects. Because what is happening is many of the universities are probably bound by the limited amount of funds which are required for doing really a worthwhile PhD research work. And therefore, many of the mentors, they try to go around what is already available in terms of the grants. And so many of the PhDs which do get eventually done may not have any great relevance in today's ambience. And if the current industries and entrepreneurs and industrialists, they really want certain types of research like what I spoke about earlier done, so that their industry becomes a more sustainable one, and it also can put in safeguards even before something dangerous or hazardous can happen. And instead of waiting for only pollution control boards to come and wrap their knuckles, so to say, but they put in things which are one step ahead, something which is avant-garde. In that case, the industry also goes forward, and you also get much greater sustainability, and the long-term lifetime of that particular technology also becomes much longer. So I don't know whether your AABN can think in these terms, that just like how we have angel investors and all that, can we have research grants where the industries can come forward and support some really good quality PhD research?
Can I
Yeah,
speak?
yeah, a good thought, but yeah, please go ahead, sir.
Yeah, I just want to put some thought process, because on this environment, in OMPL, I was heading the environment department, and honestly speaking, I'm not only in the company and outside company, I'm part of the Rotary Club, which is another NGO. Regarding the environment, what honestly I believe is, I think one gentleman, he told about Agni. I mean, you need NGOs, you need industry. It is actually the people and the administration. People don't have. Disposing of a battery. Many, maybe can include us also, saying that we dispose the everyday battery or AAA or AA battery in our everyday waste. It may go in the dry waste or in wet waste. Even classification of dry waste and wet waste, the administration is trying to feel so much of difficulty in that. So I tried to talk to one of professor of IASC. He says that people are very, very difficult to bring a machine from France to segregate wet waste and dry waste. But somebody will pack a curd rice in a plastic and throws it. The machine will have its own problems to identify whether it is a wet waste or a dry waste. So these are the problems that is created in the environment. I mean, by people. Only problem with our country is administration or the fear of administration. Whereas we come to Middle East, There is no, there is same people, they tend to follow rules, regulations in a very appropriate manner. Whereas in our place, they don't care for any rules and regulations. So this is the basic, that whether we have to follow or the enforcement of rules has to be done on the people. The enforcement is very important, because without enforcement, there is no sanctity in the law. For example, I came to know that there are some cottage industry, say in Tamil Nadu and part in Hosur or other village part of Tamil Nadu. They do this like a cottage industry at home. They do this electroplating of jewelries or artificial jewelries. The chromium reject is just dumped to the ground, because there is no effluent treatment plant for cottage industry, because it is done at home. So these are the basic things. And PhD, we can do PhD research, as Madam said. Research, nowadays research are repetitive. As soon as he gets his PhD, the research stops, and there is nothing. Only the degree has that value, or the PhD has a value, and the research doesn't have any value. So that is where in nutshell, we try to approach during our in industry. We try to approach lot of academy institution to give some solution. No, academy cannot give immediate solution also, and industry requires an immediate solution, which can be given by another industry which is already working in that field. So this is where the problem is, madam. That is what I want to put forth my thought process.
Right, sir. You said what you said was I fully appreciate. But actually, the Agni, what I was telling about it, they are the stakeholders. The final beneficiary is always the government, the community. We always promote the community-based initiatives in all the sectors. To give you an example, after super cyclone in 1999 in Odisha, community decided to have shelters, and they decided to have it in an elevated place, so that whenever there is a warning sign, so they could go up and then they stay there, come back. It was very well worked out. But what happened was, after the disaster, the people came back to their villages. These shelters started, being used by the anti-social events, and there was a lot of problems in the society. So this is a lesson we learned. So next time, what happened in Gujarat after the earthquake? So we tried to work out, but this being a urban area, we could not do much. Whereas after tsunami, it worked out very well. So what we did a study from Tiruvallur to Kanyakumari. We had a discussion with the community groups, and finally they came out with the idea that we'll have a community centers. So normal time they can use it for trainings, or it can be hired for any kind of auspicious events, which they can make some kind of a revenue. But during emergencies, it will act as a emergency center. Now it's working very well. So certain levels of understanding is with the coordination of the community, where the four stakeholders in academia, where they identify the problem and come out with the indicators, government take it as enforcement. You talked about in Middle East is happening, but the governments also vary. There are various governments. This is a social government, whereas capitalist government, communist government, military government. Now, Middle East is possible. Singapore is possible. These are small countries, and whereas India is divided into so many things. So sensitizing the people is number one, and make them to understand that they are in a very, very, very vulnerable situation, and solutions to start from the community level. And these four stakeholders, this Agni, that is academia, government, NGOs, and industry, they'll share hands, join hands, and make the community to realize their vulnerability, their strength and weakness, and what they have to do in future to safeguard the future generation. This is what systematic way of project management we have been executing. Every day we are learning something and we are implementing. And compared to 1999 super cyclone, now disaster management has come to a very different level, where from reactive level to proactive level we have come over there. And now the disasters are slowly coming down, because we are making the preparedness, prevention, and mitigations very well in the place. And even after that, something happens, we have the mechanism with the government system and in the community system also, that relief, rehabilitation, rehabilitation and reconstruction, and build back better society is happening with the Sendai framework. So a lot of things are happening with the support of academia and research and the government's sternity to take it further. Definitely, NGOs play a major role, and we look forward the industries to come forward to support us. Definitely, community is the final destination point where we have to implement the things, no doubt about it.
But the challenge, sir, Mr. Suresh, sir, fantastic discussion. Really, really very good discussion from everybody. And you also mentioned about something you want to distribute. Probably we can take it, discuss later offline. But the challenge, sir, what I see is that, we need to be again honest to answer these questions
Right.
as qualified intellectuals, right? The thing is that you look at our own people, right? Whatever you educate them, as soon as it comes to religion, they discard everything. We kind of, this is people who are not the industries, not the people. People destroy the rivers and all the lakes and everything out on religious grounds, right? How do you educate that religion has nothing to do with superstitions and throwing and dumping and wasting rivers and everything out? We call Ganges as our mother and goddess, and then we put all our dead bodies into Ganges and destroy every river with flowers and garlands and everything out. We do it, and irrespective of how you teach it, when it comes to religion, people completely forget everything, and nobody can talk anything about it. You look at every festival. If you look at Kumbh Mela, any festival happening in South or everywhere, there's so much of waste generated, and people just do. I'm just saying is one example about it. We same thing with respect to political situations. Political parties do not want people to be educated, learned, or something because they are behind their voting model. So we all this. So when people like you, for example, or Professor Madam, you're all trying to educate people one way to learn and move forward. Otherwise, people are there to pull them back without getting any education and destroy their knowledge base, everything. Also, they are become just conditioned machines. How do you address these major issues? That's a challenge for us all the time compared to other countries in the world, right?
I have a point. So I completely appreciate what Mr. Muthukumar said. Yes, I totally agree with you. We really need to bring back. There used to be a time in 80s and 90s when there was much greater interest in science-based education, even through NGOs. Currently, unfortunately, it is being looked at as a leftist kind of a thing, which is not true at all. A science-based education, even by, I remember Tamil Nadu Science Forum or Kerala Shastra Sahitya Parishad, they were all, unfortunately looked at as, left-based kind of organizations, rather than seeing that, science-based education and awareness and training of children and a scientific approach to thinking is so very necessary if we have to get out of this vicious circle that we have fallen into, where everything is being explained only through superstition, and even disasters are being explained more through all sorts of superstitions instead of scientific approach. So when I talked about PhD, I didn't mean actually only long-term research, which is important, but even very short ones. The whole the whole habit of scientific methodology. So even school students, even 10th and 12th standards, can do small. How do you? What is the research methodology? How do you go about it? How do you approach? How do you design? How do you take a problem and write it objectives and methodology and come out with the results and analyze it and say whether this is correct or not and do literature review, all those kind of things. It can be very, very small. It doesn't have to be very large as a PhD. But what I meant was that is all over the place, I see very good technologies being developed by people, by communities, by entrepreneurs, and not necessarily huge multinational organizations, but many smaller ones, including simple things like waste management, dry and wet, and composting, and everything. Maybe we need to document, maybe we need to bring out compendiums to show that how this was actually addressed, and how this technology got developed. It's so simple, it's so inexpensive, and it is so doable, and it is advanced in the sense that it is not the same old wine in new bottles, but it is actually an innovation. So this is something that I feel that under Agni or AABN, that we should really consider, bringing out these positive success stories, which can sort of motivate young people to take up short research work also.
Yeah. Muthukumar sir, you rightly said, with small example, let me finish with this. Now, Europe, earlier the churches, they used to have the candles. Now it's strictly, it has been advised by the government, and they are also communities also follow. They have the electronic candles. You pay €5 and take a candle and go and fix it up where the light goes, and you pray and come back. They'll take it and keep it over there. So that's a certain kind of what do you say, determination by the system and the community. Only it can bring a change. Otherwise, it is a sensitive issue, and nobody will be interested in keeping their hand on that, because it will lead to some other problem. So there should be a joint realization by the government and the community that we have to keep our relay. Otherwise, nature will take its own this thing and finally end up in disaster. That's what. Either it could be a biological disaster, or it could be because the water get contaminated. It could be a biological disaster, or it could be a any other geological or meteorological disaster. Finally end up. So if you don't learn a lesson, then it's our problem with nature, what it can do about it. That's what I can say about it.
It's a Kasturi sir. Please go on, sir.
Very good morning to everyone.
Yes, sir. Please go on, sir.
Very, very interesting session. Very interactive session. A lot of participants contributed. They contributed very good points, and it was a very knowledgeable session. I would like to add a few points. Madam Shyamala also talked about pollution. So Dr. Kalpana mentioned about One Health, how it is linking the humans, animals, and planet. Now, the main thing is, I would like to take only one topic about the pollution. I'm just going to make a small comparison between Chennai pollution and Delhi pollution. Delhi is always in the limelight, highlights, and media glare and everything. And so it is now a bad impression is created about Delhi that it's a highly polluted city. When you compare the population, the geography, the surrounding states, everything, still Delhi, I would say, is much better, and they have taken adequate steps in reducing the pollution. One small example, I'm talking about the smoke pollution. The smoke pollution, if you take way back in 2002, the Delhi government, along with the central government, introduced the CNG. And there used to be a chaos on the roads, to get the CNG. There used to be a handful of gas stations. Now, if you go even 100 meters, you will find a gas station, CNG station. Now, almost all the vehicles, I would say the government buses, there are about 9,000 government-run Delhi Transport Corporation buses. They are all fitted with CNG, 100%. And now, if you take the auto rickshaws, there are about 10 lakhs, which includes three-wheelers and the suburb areas of NCR, National Capital Region, that covers a part of Haryana and UP. We call it as National Capital Region. So the whole thing, if you take the whole population of auto rickshaws, the cabs, the private-run buses, we call it as chartered buses. Including the NCR region, they have made Even the e-vehicles are available. The e-rickshaws are available. So the battery run rickshaws. And in Chennai, after almost now 23 years, the CNG stations are only handful. And if you see the buses are still running, plying on the roads with diesel, and most of the buses, private buses, the trucks, all those things. Now, how we are going to address the health issues? I would like to tell you one important thing. Now, Delhi has also taken the lead along with Indian Oil, Tata Motors. Have developed around 300 buses jointly with Indian Oil Corporation R&D Center in Faridabad, Haryana, with the support of Government of India. They have carried out a trial in 2024. Around 8 buses are running. The Indian Army has taken 8 vehicles, and Indian Navy also. Now, 4 buses are running in Vadodara. So these are the fuel cell buses using hydrogen. Now we are moving into EV buses, hydrogen buses, CNG buses. In Chennai, still the buses are running with diesel, producing thick smoke, affecting the riders, the co-riders, the vehicles that are running nearby, even the two-wheelers who are standing when they wait near the signals. I find a lot of thick smoke coming out, carbon monoxide, carbon dioxide, and it is affecting the people who are not wearing the masks. They inhale the thick smoke, and it is definitely going to affect their lungs. I frankly, in my own family, I can cite some examples. Like my father, he used to be a non-smoker, teetotaler, and pure vegetarian. Never used to go to a hotel even to take food or even take snacks or a little bit of tiffins or anything. But he had ultimately 1 year he suffered. He lost his weight, and he was admitted in the ICU with a lung infection. And the same day when he passed away on December 7, 2013, 5 cases of lung infection, 5 more people passed away. So even if you say that this is due to, I would say that it is all due to pollution, smoke pollution, dust pollution, many causes of pollution. Now, after that, my own father-in-law, he also suffered. He passed away in 2006. Yeah, he used to have a very big oxygen cylinder. We never talked about the lung infection. This is a major cause of worry. The same day when my father passed away, about 6 cases, people who died on the same day in Sundaram Medical Foundation, all were with lung infection. And lung infection, they say there is no treatment. We only give high dosage of antibiotics, steroids, and things like that. And there is no solution. Recently, a couple of years back, my mother-in-law passed away. The same issue, like lung infection. She had breathing problems. Carbon dioxide accumulation was more. Oxygen intake was less. 100% masking and oxygen was the intake, but still nothing worked. And she was put on ventilator. Within half an hour, she collapsed. So I'm only saying that there is one lung institute in Delhi, and they say that even lung transplantation takes a couple of crores of rupees, and there is no guarantee that the person will survive. So this is what happening, and this is a very major issue, serious issue. And we say that there are air filters. They are put in Delhi. Here, frankly, I'm telling you, when I brought my vehicle from New Delhi to Chennai, I asked my call driver to find a pollution check point or a station. He said there is nothing like that. Don't worry. Last 12 years or about 11 years, I have not taken my pollution certificate. Frankly, all our participants now, including the presenter, the Madam Dr. Kalpana, would agree with me that we don't have pollution check. We only the people who are the traffic police who are checking, or the RTOs who are checking only the vehicle documents. They only check the license and things like that, or without helmet. That's all. But they are not checking it. The pollution check is not there. And in Delhi, it's a mandatory requirement. You have to put even in two-wheeler, three-wheeler vehicles, bus, even government-run buses, DTC buses. They are supposed to put the pollution certificate every 3 months. Every 3 months, they have to undergo the pollution test. And the carbon emission should be the bare minimum. And see, with CNG, definitely it is going down, and definitely comparatively the pollution levels are very high in Chennai. But we don't, because of the environment nearby. We are near the sea coast, so it is getting absorbed. But only problem is even the dust. And I would also say that it is not the responsibility of the administration or the only the government. It is the responsibility of the people. I mean the citizens also. So they both be, including me, that we are all responsible for the present condition of the pollution. And it's not only plastics or usage of plastic, single plastic, or the smoke pollution or things like that. Now, the only way, as rightly pointed out by Mr. Muthukumar and Mr. Pradeep, Madam Shamla, and even Mr. Pradeep, Mr. Maria Selvam, they all mentioned about one thing, very, very important thing, is that even in the religious places, yes, now the usage of camphor, things like that in the temples are now reduced. They are using ghee lamp and things like that. Now, definitely, people will start realizing the only way to educate is tapping the next gen next, and we have to inculcate the good habits. There are lack of civic senses. People just go and throw the rubbish on the roads, or anywhere on the roadside, or on the platforms and things like that. So the culture has to change. We have to improve the civic senses. The citizens, even the Gen Next, only can get easily get adapted to the cultural change. And if we can address these issues through the Gen Next, inculcating the culture, the good habits, educate them about the impact on the environments, the climate change, how it is going to affect the One Health, the concept which Dr. Kalpana Madam talked about, and how it is linking the link between the humans, animals, and planet. So these are the very, very serious issues, very serious topic, very important topic. I think it should not be end only in the webinars and in our conversation. We should take things forward and definitely go to the ground level, grassroots level, and address them, educate them, and we start propagating about the impact and how it is going to cause serious health issues, the pandemic or epidemic or whatever, like Madam said. These things, we have to, in coordination with NGOs and the government, and as a citizen of the country, we all have the responsibility to, improve the environmental conditions and improve our health. These are the points which I would like to add. Thanks a lot. Thanks for giving me the opportunity. So kind of you, Mr. Gopi.
Thank you. Thank you. Thank you. Yeah, Padmarajan. Padmarajan.
Sorry. Yeah. Thank you, sir. Thank you. Really very interesting, sir. Really, with all the panelists, lot of expertise, and it's very wonderful. But many times, being an engineer, we call it, one is theoretical side, another is a practical implementation. By seeing all the expertise and the actions are taken, educating youth and everything, I feel it's really we are doing good, but not in terms of practical. We are not moving. There are bottlenecks, mainly the politicians and like this. But I have 2-3 questions. One is not questions, just sharing the points. India, we are more consuming, and so of course, since more population, consumption is also more, and so the wastage also high. But at the same time, similar like our nation, there are China and Taiwan and other Taiwan. Okay, these countries produce lot. I mean, to supply throughout the world. I mean, so it means they consume in terms of resources more than India, of course. So now these countries what they are doing in terms of recycling, how to control, how to save, what they are doing, whether India we are learning and trying to implement. Okay, that is one point. Second point is India, we are, in employment rate wise, we are very low. Many are unemployed like this. Why not we inculcate in this kind of process, like food inspectors and road traffic inspectors, like this people are there. Why not the government create job opportunity in doing and in monitoring, in implementing this kind of activities? That is one point. Second point. Third point is we all know that in throughout India there is 100 days Prime Minister scheme. Under this, a lot of rural people are employed and they are doing. I don't know how the fund is really going into useful manner. Why not the government include this kind of activity also part of that? Thank you. Just shared my information. One more point also I would like to add, sir. When we studied during school time, we used just an example. We used ink pen. It means my father bought only one pen. I used for 4 years, just filling the ink and changing the nib. We call it that writing nib. Then when I went to college, that is abolished. I mean, not in popular. It's called a pen, ballpoint pen, and we used to get the refills from the shop. Today, if you go to any shop, nobody is telling refills are, no shops, they are selling refills. Everybody is telling buy a pen. It means in my house itself, 2 kids, they study. Almost in a year, they consume more than 100 pens. Everything is going waste and it is not recycled. Just want to hear from the panel. Thank you.
Yeah, very well, sir. It's a good observation. The first point you were talking about what we learn from other countries. So we are only documenting, but we are not implementing because, as I rightly said, there is a political will is needed to implement many things. For a country like India, which has got a long tradition, cultural variations, and differences, it's not possible to implement for the whole country. Maybe in one packet we can implement as a pilot study, and we can take it as a model, and we can show across it. That's the only thing we can do at this point, because if it is a military government like Myanmar or Pakistan or something like that, or China, where you have to obey, that's it, no questions. So that is the way they do it. But here it is not possible. There will be again a debate, it will take long time, and then, so somebody pointed out, so the government has got policies, but to certain extent, to just check it, okay, here and there, not to that level of taking it very seriously. So that's one point. So political will is lagging. Number two is the community interest in taking care of that. And sensitizing the community is the only thing we can do, and we have been doing for the past 30 years. And to certain extent, if I try for 10 years, I can get it in 1 year to happen a little bit. So, and what happened is sustainability again is a problem. See, now we trained about community-based disaster management. There we insist that communities also are a stakeholder. All the time you can expect the government to come and work it out, or NGOs or industries. You should also be prepared, and you should not do do's and don'ts are there. You learn cycling, you learn swimming, you learn this thing, so that you can also survive, and you learn a little bit of first aid so that you can manage yourself till the health services reach the place. So this is how we are sensitizing the community at our level, at a researchers level or implementation level. So beyond that, we cannot go, and the institutional problems in India. So we expect by 2030-35, maybe some major disasters happen and the lessons learned, and then it could be shown as a model, and then make the people, because now how COVID happened and people immediately obeyed and covering themselves with a mask and this thing. The fear is always the one which drives the people. Till then, it is not going to happen. So that one thing. Other thing about the employment you are talking about, that's a good suggestion. Definitely, it could be as a policy input. We can take it. Third one is that the pens you are talking about. That's a development. We cannot avoid that, but we can find a solution how to dispose in the proper way, rather saying that This is what is happening. The ballpoint was invented after this sky technology, space technology has come to the picture, because they could not use the pen or pencil in the space. So they need something which will not get create anything that will float on the air. So that the final thing is the ballpoint pen, which can refill. So it is comfortable to the people and started using it. Now it has become a culture. We cannot change it, but we have to find a solution how safely this refills can be disposed, or we can come out with an alternative invention or replacement for this refill pen. That's the only thing can happen.
Thank you, sir. Really, I appreciate for the response. Of course, I also felt for most of the points which I shared, political is the bottleneck for us. Of course, by the time us you people and we are educating youth, and the mindset will change, and the future politicians should be much better than the present politicians. I hope so. That is point one. Second is about employment. You told it's a good input. Please, sir, in your caliber and madams, and please take it up as a policy through the government. Make it educating people. See, if we bring, in rural public, those who are doing Nurunal Velai Prime Minister scheme. So,
Yeah.
as part of that, if we bring something in terms of waste management, how to treat, what is the advantage, if we bring them the mindset, from them, it will go very easy to the root level. So
See,
that
the
is
100 is MNGRA, it's a good scheme actually. We call it as a mainstreaming of disaster risk reduction in the development sector. That is, in the peacetime, identify the probable areas of hazards could happen, the vulnerabilities. And during the peacetime, we can make some mitigation thing. That is the idea in the 100. See, for example, Veeranam Lake, where we are getting water for Chennai, Veeranam Lake. So during the peacetime, the desilting of Veeranam can take place, not at the disaster time or the rainy season. The normal time we can take it, so that it is called mainstreaming of disaster risk reduction in the development activities. Another one is, for example, the Kaveri River is open. The dam is Metu Dam is open in August for agriculture. That time, if you go and check your check dams, especially Gopi might be knowing because they're all from Chidambaram, they studied over there. They have the check dams in the check dams. That has to be checked and kept ready before the dam is open. The 100 days work that can be repaired. Not exactly the day when it has been opened, and by the time the check dams are damaged, and then you get flooded water, and water is not been properly distributed, and then again problem starts with the communities. So these are things we have to think into peacetime, and peacetime we don't think about it. That's a problem. Only when the disaster comes, when we start blaming each other, pointing each other, and finding a fault with that. So this is what we are trying to sensitize the community during peacetime to and identify the problems where probable hazards could affect your day-to-day life, and make a prevention efforts and or mitigation efforts, and then try to do through 100 days this thing, so that at the time of a disaster happens, you will be safe. But that to bring it to the practical thing, we have to make understand the politicians, we have to make understand the NGOs, we have to make understand the academia, and do some studies. Oh my God, this is really, and we are tired of what to do. We need a lot of support from outside. I don't know how we are going to take it further. But anyway, we are also trying. Things are happening slowly. It's happening. Yeah.
I would like to add I would like to add a couple of points, Mr. Suresh.
Yeah.
Yeah. One is, let's not blame only the politicians. We should also blame the government officials, because the main issue is the corruption. You see, even if you take industrial pollution, the pollution control board is there, and there are many pollution inspectors and things like that, and they just go, and definitely corruption is at all levels. Okay, and unless we totally eradicate or mitigate corruption from our country, even our state, definitely these issues can't be 100% addressed. Another issue is there are no, as you rightly said, Mr. Suresh, there are no stringent rules and no punishments. When we go abroad, when we go to Middle East or go to Singapore or even US for that matter, We are all scared of those rules. We can't even spit on the road or throw a plastic bag, a sachet or something. Definitely will be fined. And here there are ways and means to escape. You can just bribe or tip the police cops or the government officials, and then escape. So unless the stringent rules are in place and punishments are also in place, and definitely the fear element has to come, and corruption has to be totally eradicated,
You're
mitigated.
absolutely right, sir. You're absolutely right. When you say government, that inclusive
Yeah,
of the elected representatives as well as the bureaucrats, both combined together. See,
exactly.
for
Yeah,
example,
yeah,
certain
yeah,
collectors, district collectors where we worked out, there are typical young IAS officers, they are very good. In Rajasthan, recently I met one young
yeah,
collector.
yeah,
He's very
yeah,
good. It's exactly he was talking about, and he's going and checking each and everything. Whereas I met
yeah,
another collector who's a conferred IAS after 20 years of service. He's been
yeah,
conferred. He doesn't have much.
yeah.
He said he's in the verge of retiring with this.
Retire.
And
Yeah.
so how I can do it? The collector is a collector. That what I can do about it.
Yeah,
This is what-
he can't be corrected because of the traditional thing which he had been following for over the years.
Yes, yes.
It's not possible for
After
him to change.
after after two districts, we worked out very well with the ink collector. Then these people called me. I said, you didn't tell us. I said, we explained
Yeah,
you. You are not prepared.
yeah,
He started boiling
yeah.
because of these people. We cannot do it over. This is again
That's,
a curse.
that's right.
We are doing it over. So continuous. That's what I said. Sustainability is very
And
important. It's not
the
the thing.
sustainability.
Yeah,
Yeah, as you rightly said, the platform which we could definitely think of, one is the academia,
yeah.
like Dr. Kalpana, the professors, esteemed professors, the school at the school level also, the children, the next have to be educated. We have to definitely tell them how it's going to really impact. One is about the culture, the civic senses, about the good habits, good deeds, and how the country can be. The first and foremost thing is thinking about the country
Yeah.
and the health of our citizens, people,
No,
and
I don't know.
how it is very essential.
No, I don't know whether you have seen my video. And I think Kobe sir, if I'm not mistaken, it's 162. I think mine.
I didn't know.
Oh, very good. I would love to see that.
Yeah, I've shown some of the videos where the school children in a village area near Dindukal, they were encouraged by the school teacher. They made their own toilet using the 20-liter
Beautiful.
boils,
Oh,
water cans. They cut in cross
okay.
cut, and then they made that as a urinal this thing
Oh,
commode, and then they connected
oh,
with the
very good.
pump. And they made their own toilet, and they got
Yeah,
50
very good.
from the company. They
Oh,
see that initiative, something like that. Another girl, one of my students, not direct
exactly.
student.
Ah,
To she came out with an idea. Once she was walking on
ah,
the Pune street, she found
ah,
many the women, they don't have a toilet. What she did, there is
yeah,
no construction, so she found there are a lot of
yeah.
buses. The Pune Transport Corporation were lying as it is, so she
Oh,
checked with the collector and she hired a old bus and then converted into a toilet with
oh,
the
very good.
education messages and everything, and it is very
Okay,
successful. It's got a health drink,
very
everything.
good.
And
Very
then
good.
particularly,
Actually, I would like to tell you one important thing. In Delhi, I'm talking about even a decade before. I mean, even 15 years before, they used to have a mobile toilet.
yeah, it is
Even in the slum areas. In the slum, you might have seen in Delhi,
correct.
like
It's
a lot
happening
of
in many places. Yeah, yeah.
yeah, a lot of small pockets of the slums
So the
used to be
way
there.
with available resource materials in the even during
Yeah.
COVID, I showed in that video. It's a check with my this thing session.
Very
I
good.
think 162. I
Okay.
think in Africa,
Uh-huh.
from the
Uh-huh.
waste material, they made the hand washing
Oh,
this thing with a pedal,
okay.
and then one side is the bottle. Just press one
Very
pedal,
good.
the bottle comes, and the
Okay.
other pedal from the 20-liter water can, it tilts, and then you get
Yeah.
the water. It's all completely from the waste material.
Waste
So
material.
ideas are there. We have to encourage the young
Yeah.
youth, and we have to
Yeah.
give an encouragement. Definitely, we can
Yeah.
achieve. No problem. No,
We
no
can
doubt.
achieve.
Yeah.
Yeah, I think, as you rightly said, this is also one of the very, very critical issues like waste management.
Yeah. Yeah.
That should be definitely, even in the course curricula, we have to introduce this waste management as a full-fledged course.
The
And
natural.
people should specialize in that. And then definitely they should, even I think we should create a department
Yeah.
Instead of having one Metro Water and Sewage Board, we should have a separate department for waste management and innovative ideas. Like the government, and I'm talking about both the governments, central and state,
Next
and
week,
in support
probably,
of like.
probably next week, in a couple of weeks, I'm trying to introduce Priya Darshini, who is a very successful
very good.
entrepreneur.
Very
From
good.
she's a turnover is in crores, making money from the waste, and she could demonstrate some of our ventures.
Oh, very
as a
good. I
continuation of
think
this.
we should invite her. We should invite her, and I would love to see your videos. I'll take the help of Mr. Gopi, and definitely
Yeah,
I'll go through.
162. I think 162. Gopi sir, just send him the link, please.
In
you
case
can,
you need any assistance from my side, I'm always with you.
no, you
In
can
this
check
kind
the
of
gallery, sir. You can check the gallery, AABN gallery. I think 162 now. 62 is mine.
Okay.
And Mangalam madam is also there. Very next week, she talked about elaborately on waste management. She's an expert on that, and you can also
very
check
good.
out on.
Definitely, I'll check out.
The
And
nutshell
in
of
case you
what
need my assistance in your mission, definitely I would like to be a participant in it.
as a nutshell of
take active participation.
Yeah, it's now 1 o'clock. That's a nutshell of what Dr. Kalpana was talking about. Animal health, human health, and environmental health all have got a linkage with each other. If intervention goes wrong, it is going to affect human health as well as animal health and environmental health.
The entire ecosystem.
Yeah, it has got an ecosystem coverage over there. So, to give a small example and close the session, suppose we are going in a taxi thinking that we are safely traveling. How do you know that? I had an experience that the driver is from Punjab and he had a TB. The were raised and then the AC was on, and I was thinking that I'm traveling in a taxi, I'm in a safe. When he started coughing, I asked him, he said, I have a TB. Then I said, okay, it's better you take a rest and then I'll take another vehicle. So how do you know? Knowing that we're all highly vulnerable every point and nook and corner. You think we are having food and we are living in a very, very safe condition, but we don't know at any point of time we are vulnerable to any kind of disease, and that could be because of animal health or because of environmental health. That is where we are trying to combine all these things. And if physical health is affected, mental health also is going to be affected.
Mental health is affected.
Loss in productivity. So we have to be very careful and trying our level best to give solutions to solve this problem. Okay. Thank you very
much. Thanks a lot, Mr. Suresh, Mr. Selvam. Thanks a lot. Very insightful. And thanks, Mr. Gopi.
Thank you, sir. Thank you, sir.
Thank you. Have a wonderful day. Thank you.
Thank you. Thanks, sir.